Agents, hey, this is Luis Moreno with Insurance Agent Training. All right, so got an email from an agent who is coming from a call center environment and is thinking about going independent. His question to me is, Luis, hey, well, let's just read the question straight from the email that he sent me. So here is the question. It says, I want to start selling Medicare supplemental plans, ACA, dental, and vision on my own. I have a year and 3 months of experience selling Medicare as a W-2 employee, and I'd like to start my own business. So, as a W-2 employee, I'm getting the impression that he is working at a call center or he's working at an agency and getting paid. All right. I'd like to start my own business. Okay, cool. Hell yeah, why not? So far, I don't know how to sell supplemental plans. I just have an idea. Is it convenient to sell both Medicare and supplemental plans like MedSups? I'll go over that here in this video. And I'm wondering, how fast can I grow the business? Because I want to stop my current job and stop receiving my salary plus commission. And I'd like to know how long it would take for me to make $5,000 a month or more in commission selling these products. So that's a loaded question. So I'm going to give you the best answer that I got. All right, so here we go. So let's get into this. So I will just tell you, when you're coming from a W-2 job, my opinion, okay, or a call center, I've never worked at a call center, you're being fed leads, okay? So the organization, the call center, wherever you're working for, they're spending money on marketing to generate leads, okay? Then what they do is they give you those leads. So you don't worry about marketing, okay? You just worry about getting those people on the phone and doing your job and trying to sell them a plan and do your thing. Okay. Well, when you become an independent agent and you're doing this all on your own, get ready, because not only do you have to do that job, but you gotta find a way to make your phone ring. All right. So that's the biggest challenge for independent agents when they're coming from that kind of environment to an environment where you're an independent agent, you get paid the full commissions, and now you got to figure out how to make your phone ring. So the question might be next is, well, how do I make my phone ring? Well, there's no rock that's unturned. There's no secret. There's no pot of gold out there at the end of the rainbow. So there is no, oh, if I get this lease, I'm going to make $1 million. Man, if I had that, I'd be living in my own island, okay? And not making videos here and working still. So I will tell you, grassroots marketing, you're going to have to do social media marketing. You're going to have to buy leads. You're going to have to get out there and beat the streets and drum up some business. So agents ask me, well, what do you consider grassroots? Well, grassroots means you're going to get out in your community and you're going to do events, you're going to do seminars, you're going to maybe host a retail booth at a maybe a grocery store, a pharmacy. You're going to connect with doctors. You're going to host events. You got to get out in the community and connect with people so that they can connect with you. You can help them with their Medicare. That's like kind of like, but it's very slow going. I mean, you're not going to do something and you may get a few leads, but you're going to have to get out there and hustle. Now, social media, where you can do posts or you can do sponsored ads out there where you target seniors. But guess what? Everybody's doing it. So everybody's competing for that senior. Well, with high demand for that one senior comes an increased cost in those leads. But guess what? A lot of lead companies are doing social media also. So you might as well do it yourself and cut out the lead company and save yourself some money. But you got to learn how to run ads. Okay. Then you can also buy leads. Now, I've had mixed experiences. I don't like buying leads from lead companies, but I do think that if you're willing to get out there and beat the street, put a lot of windshield time, you can work direct mail leads. They're still effective, but it takes a ton of work. You're not going to get those direct mail leads and call and answer. That's not going to be happening. What you're going to have to do is you're going to have to do that and try to set your appointments. But since they filled out that form and they're giving you permission to contact, you may be, door knocking those people. Okay, it's not a cold door knock. You got a direct mail lead and they agree to give you their information and for you to contact them. So you've got to get out there. All right, so that's my little spill on marketing. Now, can you do it? Like, hell yeah, I think you can do it. I think call center agents are very well trained. They're not afraid to be on the phone. You can get out there, but who are you going to call? You just can't cold call people. You got to have that permission to contact. All right. So with that being said, if you can overcome that challenge, if you feel that you can get out there and market and do what I said, oh, the other thing I forgot about grassroots flea markets. I work the flea markets a lot. Those are the open air markets, Saturdays and Sundays during AEP, OEP for ACA. I mean, you've really got to get out there. All right. So now let's get into the money. What kind of money can I make? So I'm going to share with you the commissions for 2026 for Medicare. All right. Here's the grid for 2026. And so we'll do some predictions on income. This individual wants to make about 50,000. So let's take a look at here. So you have 2026 commissions. If you write somebody who is new to Medicare, you're going to make $694. This is not new to you. It's new to Medicare. Then after the year, it goes into the renewal phase and you're going to make $347. If you're in these 3 states, you get a little bit more money. If you're in these 2 states, man, you're banking, making a heck of a lot more money. All right, so we're going to use what I'm going to do to show you this math that I'm going to work on is I'm going to use the renewal $347. I'm not, because nobody is lucky enough to just write only new or initials. All right, most people are dealing with seniors. As soon as I can find my pen here where I do my writing, most people are dealing with seniors, where they already have a plan and they're flipping them over to another plan. All right, so let's just do MAPD prediction here. All right, so MAPD, Medicare Advantage plans, okay, 347 per year. All right, you're going to get paid this I'm going to divide this by 12. And you're going to make $28.91 a month. Okay. You're not going to get it all at once. You're going to get this monthly. So let's say that you've got 100 MAPDs where you're going to make $34,700 a year in commissions. 200 MAPDs under your belt. You're going to make now $69,400. And let's just do this here at 400. You're looking at 138K. Man, that's some good money for 400 policies. So the individual who emailed me wants to make about 5,000 a month. Well, this is your magic number. You got to write about 200 of these. Now, these are MAPDs. Med subs are a little bit different. I can't spell right now. Okay, here we go. Med subs. So med subs, you're going to make anywhere between 20 to 22% commission based on that premium. So somebody turning 65, it's based on whether they smoke, their zip codes, their gender. Let's just do an average $130 a month. So 130 times, let's just do 20%. It's $26 times 12. You're going to make on a new business, you're going to make about $312 commission on that med sub. PDPs, there are a lot of prescription drug plans that you will pair with this that don't pay commissions. Okay, Welker doesn't pay, Aetna doesn't pay. I think United pays, and so does Humana, I believe Cigna. So depending on the plan, you may or may not get paid. I'm just going to leave that blank for now. Okay, there's some additional monies that you can make with Medicare. So you can sell hospital indemnity plans, which I love. Okay, the one that I highly recommend is Heartland National. If you don't have them, hit me up and I'll send you a contract. But it pairs beautifully with MedSubs. You make, heck, I don't know what the commission is, but if you sell a policy that covers their hospital copay, their doctor copay, hospital copay, ER, and ambulance copay, and add the cancer rider, you get the premium around $40 a month. You're going to make about $300 commission, somewhere in that ballpark. 200 and something, somewhere in there. It's really, really good, and it pairs beautifully with an MAPD. If you're going to sell MedSub, well, MedSubs don't have any dental and vision, so you're definitely going to add a dental and vision plan. Make about 30% commission. Let's say it's a senior. You're talking maybe $50 a month. At 600 a year times 3. So you're making on each dental and vision plan an additional $180. Not bad. Okay. And then if you're really, really pushing it, make a separate appointment after you're done with your Medicare. Come back and talk to them. You've got some final expense that you can sell. Okay. So a lot of money potential with this. Okay. Now, the next question I got, I'm going to close this out and I'm going to make another one because he also mentioned that he wanted to sell ACA. So let's get into ACA. ACA commissions are all over the board. I'm going to go with a lowball commission of $20 per member per month. So if you've got 100 members, okay, I don't know what this is, but I'm just going to make sure. Yeah, I screwed it up last time. If you got 100 members, you're making about $24,000 a month. Now, when you go write mom, dad, and 2 kids, that's 4 members, guys. Okay, they do it not per policy, but for each head that is insured. So you got 200 members, you're at 48K. You got 400 members, you're at 96K. You're making some really, really good money. Now, most ACA plans do not cover dental and vision. Okay, so let's say you sell that mom, dad, and 2 kid policies, you're looking maybe at about 130 a month. You're looking at commission on this dental and vision annually, $468. Not bad. That's per policy. This is like a family premium. Okay. Then you definitely got to cross sell your Allstate indemnity products. Okay. I think you make about 40% commission on that one. These Allstate products, what they do is they help bridge the gap on that out-of-pocket maximum in case they're in an accident or in case that they're hospitalized. And premium is based on age and gender and how many people you're insuring. And then you're definitely going to want to sell life insurance to these people, right? So there's a lot of money potential. Okay, so now you're looking, you see these numbers. First of all, if you don't have a dental and vision carrier, I love using Emeritus. Do me a favor and do this for me, okay? If you need a contract, shoot me an email. My email's in the description below. Allstate Health Solutions, shoot me an email. If you need some life carriers, I will hook you up too. All right, that's what you've got there, guys. Now, to do the follow-up question for this individual is he mentioned, well, how long will it take? It's impossible to answer. I mean, if you're out there hustling, my opinion, you're doing Medicare, you're doing ACA, you sell heavily during AEP, you sell heavily during the OEP for ACA, then you have an OEP for Medicare, which is the first quarter, and then you're hustling all year long, making 60,000, 50,000, easy. Quickly in 1 year. If you're the agent, well, I'm just going to sit at home and see if my phone's going to ring. Okay, I'm going to do some posts and I'm going to wait for people to call me. It's going to take you a while. This business, you've got to hustle. You're running against guys that are out there hustling. So if you're the hustler, you want to get out there, you're going to do grassroots marketing, flea markets, event centers. You're going to run some seminars. You're going to run maybe a retail booth, and you got to connect with your upline and get the carrier to set you up in a retail center. You're going to go to senior centers and do bingos and movie nights and ice cream night, whatever. You get out there and do that. For ACA, a lot of social media works, but everybody's doing social media. So it kind of really depends on what you're going to do, what you're going to want to do. But I did very well at the flea market for ACA. But I've also established a lot of connections with other agents, with circles of influence, like accountants, tax preparers, doctors, financial pros. Get out there and connect with those people. See if they can share their books of business with you when they need health insurance. So now you know the answer, guys. Nothing is ever easy. You got to work hard at this thing, super hard. If you need contracts, hit me up. Finally, guys, if you're in the business, you're like, man, what can I do? Let's assume you want to stay with your upline. I created a community. It's a paid membership. It's $50 a month. But all the training that I do for my agents, you can get it. So I don't make any overrides. You sell, I don't make a penny, but I got to make a living. So if you want to join the community, all the training and support that I offer my agents, you get to have it, even though you're not part of my organization, but you're part of the community. I have my ACA Smart Book, my Medicare Smart Books. I got an ACA 101 course. Guys, all the links are down below. And then finally, if you want to learn how to market on social media, okay, I've got the best lady that will teach you, that has a course that will teach you how to run social media. It's her info's down below. And the last thing, this is the most important. You know what? I should have said this first. Guys, if you don't have a CRM, it is a must-have tool. Got to have a CRM. Okay, I use Agent CRM exclusively for my agency. I'm running a P&C shop, got a Medicare shop, an ACA shop, sell life, dental vision, everything. Agent CRM is my go-to CRM. I will have my link for you to get into the CRM. Try it for 14 days. It's $97 a month. Okay, it is the best tool. The rate of return on that investment is huge. Plus, you need it for so many reasons. You get access to everything that the Agent CRM people produce, the support, the bundles, everything they get. Plus, when you use my link, same price, you get everything that I created. Okay, my ACA workflows, my Medicare workflows, my life insurance workflows, my dental and vision workflows. If you're a P&C guy, I'll give you my P&C workflows. New business, onboarding, retention, events, you're going to get all of that. So take advantage of my tools. Guys, I'd love to have you. Don't forget, please comment down below. Give me that thumbs up in the video so you can get out there to more agents. And finally, subscribe to my channel if you're not a subscriber.